Yes, my name is James Barongo Bashweka from Tanzania. I'm presenting my thesis on the role of leadership in the management of maternal health services in Kagera Region, Tanzania. Maternal health leadership capacities are very important components in the entire maternal health programs for effective running and management of maternal health. Maternal health leadership is about self-leadership for maternal health leaders, others, leadership for others, staff for maternal workforces, the organization, and the community in which the leaders operate. This is as per maternal health competence leadership of 2009. It is for the matter it is for that matter leadership was considered under this thesis in the terms of the 4 dimensions. In this article, the author will concentrate on the leadership capacity in the management of maternal health care in Kagera Region, Tanzania, in terms of self, others, and the wider community. Summary: maternal health is defined as the health of mother of woman during pregnancy, childbirth, and the postnatal period of 2 days of termination of the pregnancy, according to WHO. It was included in the 7th Primary Health Care of Environmental Declaration S4 2000 by World Health Organization. PAC maternal health targets were not achieved because of various reasons, including leadership. This was also replaced by health sector reform to strengthen leadership capacity through the process of introducing substantial changes in the structure and the function of the sector for promotion of equity. This is according to the Minister of Health Tanzania. Health sector reform also faced the challenges of leadership due to failure to set clear indicator for its impact, equity, efficiency, and effectiveness, quality, sustainability, and social participation in the evaluation of tools and the overall performance, such as maternal mortality. The sector reform was complemented also by the Millennium Development Goal, particularly Goal 4 and 5, which targeted for reduction of maternal mortality rates at maximum level. Currently, it has been incorporated under the Sustainable Development Goal 2.3.1, targeting to reduce maternal mortality rates at 70 per 10,000 live births of mothers. The study area was the Kagera Region. Kagera Region, Tanzania, health management team reported low user rate of maternal health services among the mothers of childbearing 15 to 14 years. This is according to the Region Health Management Team report of 2015. It was reported that there is a maternal mortality rate of 19 per 100,000 per live birth. It was further highlighted by the regional management team that this challenge to some extent is linked with leadership gap system, near system. Problem statement: despite of applied strategies in management of maternal service in the Kagera region, the rate of decreasing has been too slow, which may lead to failure to meet sustainable development goal, which is target of 7%, and set target of maternal health of 70 per 100,000 live births. Moreover, leadership strategy in the management of maternal health services and the extent to which leadership play part in decreasing maternal health has not been studied and documented, which indicates that there is a limited understanding on how leadership plays a role in maternal management. As the researcher feel that past and current management maternal leadership strategy in maternal health management failed to address underlying uh, factors, particularly on management. This has triggered the mind of the researcher to engage in these studies with the following objective. There are three objectives: determine the health system leadership capacities in the management of maternal health care in Kagera Region. Also to describe the strengths, weaknesses, opportunities under the maternal health strategy for management of Kagera Region maternal health service in Kagera Region. To investigate the required measures for effective leadership management in order to improve maternal health services. The question to be answered by this test was, what are capacities of the leadership, as leadership, in order to effect managing maternal health services? And what are strengths, weaknesses, and opportunities within strategies in maternal services in Kagera Region? And what possible measures to effect leadership management in order to improve maternal health services? The research aimed to explore the leadership for effective management of maternal health services in Kagera Region, Tanzania. It is an explorative research on leadership capacities in the management of maternal services in Kagera Region, concentrated on self and other staff and the organization in which leaders operate. It was anticipated that acquiring information about the role of leadership in the management of maternal services would bridge the gaps in the connection to improvement of current maternal mortality rates. This in turn will result in improvement of maternal health services in Kagera Region, Tanzania. It is an exploratory study that used the qualitative approach of in-depth interviews to facilitate the correction of data correction. Respondents for interviews that was scheduled involved maternal health leaders from district council health management teams, members, and the regional health management teams, which are regional health management teams. That was one. It used a purposeful sampling, was used to correct information from information-rich case. The reason behind for using purposeful sampling based on the information-rich case for in-depth insight. These are readers of the maternal service in Kagera Region. Approval was sought from Texas University and seeking permission from the government of Tanzania authority, and the participation was voluntary. Informed consent from participants was sought, and the confidentiality was adhered. This section provided findings which were reviewed by study on the role of leadership in management of maternal services in Kagera Region, Tanzania. The presentation concentrates on objective 1 about determining a system capacity in management of maternal services. These findings have been put in maternal leadership awareness, competence of leaders with respect to others, leadership competencies with respect to the wider community. Reviewed items were coded and analyzed as shown in the graphs below. Coded results include knowledge of maternal health service, self-reflection capacities of interviewed participant, ethics, professionalism, and critical thinking. You see that the knowledge was very high on maternal knowledge, but self-reflection was low, Ethics was a bit low also. Professionalism was reported high, and critical thinking very low. On working with the committees, there was a communication, highly communicated, highly ranked, and negotiation was not recorded, reported. There was also developing others through teaching, which is a lot of the leaders in maternal health. Developing others through mentoring, which was linked to the same, and interdisciplinary team building, which was not reported. Working with the community was also reported highly in the coding, which included working with system, policy adherence, and the policy advocacy. There was also communication, negotiation, developing others through teaching, developing others through mentoring, and the interdisciplinary. So this is, I think, it is a petition. Now that's a bit of discussion. Maternal leadership awareness from this study was reviewed to be by respondent to have a capacity, recognizing that it is important of strong leadership in maternal services. Coded item in self-competence included professionalism, ethics. These have been mentioned above. Leadership competence for wider community was also coded, as I mentioned above. The findings also therefore this findings included high level of understanding on working with the community, high level of understanding on policy adherence, high level of understanding on working with the communities. However, it was observed that respondents lacked awareness on and recognition of ethics, self-reflection, and critical thinking. Sorry. We're also less aware on developing others through mentoring, interdisciplinary team buildings, and negotiation. Conclusion. The research revealed that respondents who were maternal leaders possessed practiced leadership competencies in maternal services through their routine duty through their routine duties, which include supervision, staff meeting, mentoring, and supportive supervision. This means that leadership plays a big role in the provision of maternal service, as it was acknowledged by a majority of respondents under this study. However, there was a lack of understanding about what is leadership capacity and competencies in maternal services, which may mean that they practice their competence by using the guidelines and policies and being unaware on what most of respondents noted that previous provision of directives.
Excuse me, Mr. James, the time's up. You please complete in 1 minute of time.
Okay. Conclusion. Recommendation that there's a need to incorporate maternal SC leadership competencies in the entire maternal SC leadership the management in Kagera region. I therefore recommend that this maternal SC leadership competence should be incorporated. As the time is over, thank you very much for listening.